Do consumers really change their habits when sugary options come with extra tax? The Canadian Taxpayers Federation, CTF, says taxes on sugar-sweetened beverages that are meant to encourage people to make healthier choices don't actually work, but a Waterloo, Ontario-based researcher says they have drawn on very little of the real evidence in making their claim. The Federation released a report Thursday that evaluated countries and cities where a sugar or fat tax was introduced and said the results show these taxes have not had a serious, sustained impact on consumption or obesity rates. Listen, Canadian Taxpayers Federation releases report that claims sugar taxes don't work. View link. Read more. Liberals weighing pros and cons of a soft drink tax. What we found was, in a lot of cases, whatever the good intentions of these taxes, which is to decrease obesity and improve public health, the results really do not bear any fruit, CTF Federal Director Aaron Wudrick said. Wudrick pointed to Mexico as one example where a sugar tax has failed, despite health experts calling it a success story. He said although consumption dropped by 6% after Mexico introduced a 10% soda tax, demand tends toward inelasticity as the decrease is less than the amount of the actual tax. He also said that demand has started to increase after this initial drop. So, the result is the government has quite a bit of money from this tax, but it hasn't achieved the object of reducing the obesity rate, Wudrick said. Watch below. Can taxing sugary drinks reduce obesity? Read more. A tax on sugary drinks would save 13,000 lives and raise $43 billion, Canadian study suggests. But a researcher at the School of Public Health at the University of Waterloo said consumption doesn't need to decrease by the same amount as the tax to introduce significant health benefits. That's equivalent to about 32 million Mexicans drinking less sugary drinks at the same time as the government in Mexico gained somewhere around $145 million in revenue from the first year, Professor David Hammond said. By any stretch of the imagination, that's a positive health outcome. Here's how the math works out, according to Hammond. If there are 150 calories in a can of pop and you drink one pop a day, that's about 54,750 calories in a year and more than 1 million calories over 25 years. What you're talking about is a huge amount of energy and calorie intake, he said. Those little changes in our dietary intake are what explains the huge increase we've seen in obesity over the last 30 years. But, what about the fact consumption is rising again in Mexico? Listen, University of Waterloo Professor David Hammond reacts to Canadian Taxpayers Federation report. View link. Read more. Diabetes Canada calling on New Brunswick Premier to impose soda tax. Seema Nagpal, the senior leader for public policy at Diabetes Canada, said you have to expect consumption will vary from year to year. Nobody expects this to be a magical situation that will drive consumption down immediately and sustained without changes. We don't live in a bubble.